How does microsurgery reattach tiny vessels in reconstructive surgery? Imagine trying to connect a tiny water hose to an even smaller pipe, all under a microscope. That's essentially what microsurgery involves when reattaching tiny blood vessels during reconstructive procedures. Surgeons use a high-powered microscope that can magnify the vessels up to 20 times or more, allowing them to see and work on vessels less than 1 millimeter in diameter. These vessels are so small that even the slightest mistake can block blood flow, which is why precision is key. The process begins with harvesting tissue from a donor site on the patient's body. This tissue could be skin, muscle, bone, or a combination, depending on what's needed to repair the defect. The surgeon carefully isolates the small arteries and veins that supply this tissue. Next, they clean the vessel ends by removing any surrounding tissue, called adventitia, and gently dilate the openings to prepare for connection. Temporary clips are often placed on the vessels to hold them steady without tension. Using ultrafine sutures, usually thinner than a human hair, the surgeon stitches the vessel ends together. These tiny sutures are placed with extreme care to avoid catching the back wall of the vessel, which could cause narrowing or blockage. The suturing typically starts on the dorsal side to ensure proper alignment, then continues around the circumference. In some cases, surgeons might use specialized devices called couplers to connect veins more quickly and reliably. Once the sutures are in place, the clips are removed, and the surgeon checks for any leaks or blockages. Restoring blood flow is critical because it supplies oxygen and nutrients, allowing the transplanted tissue to survive and integrate with the surrounding tissue. In reconstructive surgery for skin cancer patients, this technique is especially valuable. When large areas of skin and underlying tissues are removed, microsurgery allows surgeons to transfer well-vascularized tissue to the site. This promotes faster healing, reduces the risk of tissue death, and helps restore both appearance and function. Microsurgical vessel reattachment requires highly specialized training, steady hands, and advanced equipment. It's a remarkable skill that makes it possible to repair complex tissue defects and improve patient outcomes. Always remember, if you're considering reconstructive surgery, consult a qualified specialist who can tailor the approach to your individual needs and ensure the best possible results.